This is a basic approach to reading ultrasound. This is going to be presented by me, Arjun Panduri. I'm a current fourth-year medical student at the Wake Forest School of Medicine. So just a general brief overview of how ultrasound works. It's important to note that ultrasound is not ionizing radiation. It's all acoustic energy that has a frequency above human hearing. Probes and transducers are the mouth and ears of the machine. They are very important. A sound wave is made by a piezoelectric transducer in a probe. These vibrate when hit with electricity and convert received sound waves back into electricity. Probes generally have a fixed frequency. This can be changed by changing the probe, not machine input to the probe. I'll go over different types of probes later on. Probes can be selected with different frequencies, and settings can also be changed to alter the focal zone for visualization. Sound waves are emitted by a transducer and travel through tissue. Some waves can be reflected back to the transducer. This transducer is able to calculate distance based on time taken to return. Some general pros and cons of ultrasound. One pro is that it is a widely accessible piece of imaging. Just about every hospital has access to ultrasound. Also, it's relatively inexpensive. There's also no ionizing radiation, unlike X-rays or CT scans. It also has a good ability to do real-time functional imaging, and it's better at visualizing structures in smaller patients. One example would be diagnosing appendicitis in a pediatric or thin patient, a smaller patient population. It's also great for procedural guidance, as shown in the image on this screen. This is an ultrasound-guided biopsy of a left neck node. One con is that it is very operator dependent, so you must be skilled in ultrasound and able to obtain proper imaging. It also does not image well through bones or gas, and artifacts can be prevalent. There's a few different types of ultrasound modes that I want to go over. Here we have the B mode on the top right. The B stands for brightness. This is most used in ultrasound. It's a linear array of transducers that scans planes through the body and can be seen as a 2D image. The M mode has more limited use. It's a rapid sequence of B mode scans, and in this one, images follow each other to measure range of motion. On the bottom right, we see an example of M mode. Another type of imaging is the Doppler mode, which uses the Doppler effect. This can evaluate if structures are moving towards or away from a probe and relative velocity, and is primarily used for vascular structures. Now I'd like to go over some important technical considerations. Probe selection is very important. There's an inverse relationship between frequency and depth of imaging possible. With low frequency, we're typically using curved probes, as seen on the right. These are 2 to 4 megahertz generally, and can image deeper and have a wider field of view. They can be used for pelvic, obstetric, and abdominal imaging. High frequency is typically linear probes. These are 7 to 15 megahertz and can be better for imaging superficial structures like the neck and superficial vessels. There cannot be any air between the probe and image structure, and it must be safe to apply gel to the surface above the image structure as well. In terms of how to look at an ultrasound image, there's a depth meter on the side of images, and these will be shown on the next slide. There's several markers for focal zones, and lesions are best resolved at focal zones. A bright lesion is hyperechoic. An intermediate lesion is isoechoic. A dark lesion is hypoechoic, and a very dark lesion is anechoic. So here we have some examples. On the top left is a hyperechoic lesion on the right hepatic lobe. Note the centimeter markers on the left hand of the screen. Also note that this is a curved low-frequency probe, which can be told through the curved margin at the top of the image. The hourglass symbols identify the depth of the focal zone, which can be changed by the operator. On the bottom left is a hypoechoic lesion in the subcutaneous tissue of the right lower back. This turned out to be a lymphoma. Note that this is a linear high-frequency probe, which you can tell by the straight margin at the top of the image. This was done to evaluate a palpable abnormality. On the bottom right is an anechoic lesion. This is a kidney cyst. And on the top right is a isoechoic lesion. Some more important characteristics when looking at ultrasound image. Acoustic shadowing deep to a lesion, showing a hypoechoic band extending deep from the lesion. If we see clean shadowing, that will be a calcified structure. If we see dirty shadowing, that will be a gas. Acoustic enhancement deep to a lesion, showing a hyperechoic band extending deep from the lesion. And this can be seen with cysts and vascular lesions. Here we have an example of an acoustic enhancement deep to a left breast cyst. On the left, we have acoustic shadowing deep to several hyperechoic structures, which are gallstones layering in the gallbladder. On the right, we have acoustic shadowing deep to gas in the anterior wall of the urinary bladder in this patient with emphysematous cystitis. Thank you for listening to my slideshow. And I hope I was able to give you a better understanding of how to read ultrasound.